My name is Mike Frankel, and I'm the director of the Marcus Stroke and Neuroscience Center at Grady Hospital. And it is my distinct pleasure to present this award to Aaron Anderson as this year's Next Generation Healer. When we heard about Aaron and his training in Alabama, we knew that he was the guy that we wanted to have on our faculty. We tell our students and our trainees to watch and learn, whether it's an outpatient visit to talk about how to reduce the risk of stroke, or a very serious conversation at the bedside of a critically ill patient. Aaron is quite simply the doctor we all would like to be.
By the time Dr. Aaron Anderson learned to identify stroke, the damage was already done. His great-aunt Pearl suffered an episode 3 weeks before Aaron was scheduled to attend medical school. Nobody, not even Pearl, realized it had happened. But when Pearl began to slur her words, her family finally insisted on taking her to the hospital. In the ER, Aaron Anderson and his family were told that Pearl had suffered a stroke, the effects of which would likely be permanent. The realization soon set in. Had they seen the signs earlier, Pearl's family could have identified her stroke and gotten her the help she needed in those first critical moments, but they never even knew to look. As a vascular neurologist, Dr. Anderson learned his family wasn't the only one suffering from a lack of information. Where stroke was concerned, there was too little being done to educate the community. In this, Dr. Anderson found his calling, not just in treating stroke victims, but in teaching the public how to fight back. When the Marcus Stroke and Neuroscience Center opened its doors in 2010, Aaron Anderson walked in and found a home. He saw Dr. Frankel's vision for the center and was eager to be part of a rising program. Grady's resources allowed him to conduct research on a daily basis that would be impossible elsewhere. Among other areas of study, Dr. Anderson is passionate about identifying racial disparities in stroke cases, a cause that's led him to help raise African American participation in community research.
We live in a community that's in the heart of the stroke belt. He's going to help us understand perceptions of risk and how we mobilize the community.
During his free time, Dr. Anderson attends church Bible studies and public health fairs, educating the community about stroke prevention and early detection. For him, treating strokes is not the goal. The goal is to keep them from happening altogether. Despite his contributions, Dr. Anderson will never have the opportunity to make his Aunt Pearl whole again. But with every speech he gives and every hour he works, Dr. Anderson gives somebody the knowledge to fight stroke before it ever reaches Grady's doors. And when you're dealing with stroke, time is everything.